am Hans John, the 2019 Vincent Muna. I took the COVID-19 vaccine and so should you. Let's be an example to others. Get vaccinated today and help control the spread of COVID-19.
Vaccinate if you want to eliminate the spread of the virus in our place, and do not procrastinate, but rather let us vaccinate. Get vaccinated today.
Welcome to this week's edition of Roundtable Talk. Of course, COVID-19 continues to be an issue of great concern here in St. Vincent and the Grenadines. And the spotlight once again on this evening's program will be on that topic. Joining me, as usual, the Chief Medical Officer, Dr. Simone Keyser-Beach, and also two of the persons who are working behind the scenes to manage COVID-19 here in St. Vincent and the Grenadines, in the person of Chief Laboratory Technologist Elliot Samuel and Health Nursing Supervisor Glendarine Brown. And I hope I got that pronunciation correct this time. Ladies and gentlemen, welcome.
Thank you for having me.
Going to start first by asking Dr. Beach to just give us a status update as usual. What's happening? What's trending?
Okay, good evening, and thanks for having us again. So as of yesterday's figures, we have currently 4,729 confirmed cases of coronavirus in St. Vincent, COVID-19, of which 1,699 cases are active. We have unfortunately recorded 56 deaths, of which 21 occurred in September and 23 so far for October. We reported 92 positive cases in all over Tuesday and Monday and Tuesday. So 63 cases on Monday with a positivity of 28.3% and 29 cases on Tuesday with a positivity of 18.1%. Also, we had 64 rapid antigen tests on Monday and 26 rapid antigen tests on Tuesday. So that's where we are right now in terms of the cases for COVID. And in terms of vaccinations, in terms of clean vaccine numbers, 38,030 doses have been given so far, of which 23,127 are first doses. So that's our update.
Okay, great. So we have seen a rise in the cases. What do you think is responsible for this increase?
Well, we have confirmed the presence of the Gamma variant of the coronavirus, SARS-CoV-2. We also have the Delta variant and the new variant. The Gamma is known to be a quick spreader, spreads very easily, much more easily than the Alpha and the other earlier variants. And we think that is a major reason. Also, we have a population that sadly does not have the immunity that it might have if they were vaccinated. And so the majority of our cases, in terms of cases of coronavirus, are unvaccinated persons. We do have persons who are vaccinated, either fully or partially. So we have about 200 cases. But the majority of cases, the persons driving this current spike compared with the one we had in January, February, where we had no access to any vaccines. This spike is among the unvaccinated persons mainly, and being triggered by the variants, which are extremely contagious, and also too where we have persons still not using their masks properly, consistently, and persons still gathering. Persons are gathering as if everything is usual, and we know once you have multiple persons in a smaller space, not using their mask, and you have a highly contagious variant, you're going to have spread.
So we also have with us the Chief Laboratory Technologist. Testing is very important. I know within the last couple of weeks, you were under some bit of strain at the lab. Tell me, how are things going now, first of all?
So let me just say thank you for having me again. It's really a pleasure to be here on behalf of the Ministry of Health. You are correct. I mean, for the last couple of weeks, the molecular laboratory was under immense pressure in terms of keeping up with the workload and being able to do what we are set out to do. And that's in terms of providing the information to the public health team so they can mitigate. We found ourselves in a rut, similar to where we were back in December and January of 2020. Some things are just inevitable. When you have your sample input exceeding your capacity to put out, that is what happens, and it's a scenario that has played out itself in many of the countries: Trinidad, Barbados, Grenada. So, I was thinking that sometime you're flying a plane and you hear your pilot say that you got to brace for turbulence. I mean, if he could have gone around it, he probably may have, but some things are just unavoidable. Right now, I think owing to the decision that was taken by the Ministry of Health and the extension, the Cabinet of St. Vincent and the Grenadines, where we sort of temporarily transferred off a specific category of testing to the private sector, we have now been able to clear the backlog. As of last weekend, we were not behind. We would have cleared some 2,300 samples in a few days because we were able to concentrate on getting that testing done, and we were not really bogged down by trying to get a test for somebody who was leaving the next day. And we are in a good space now, but we can't get too complacent, we can't get too comfortable, because we know there's a lot ahead of us, and there's a lot that is expected of lab services.
So you noted that you had in fact shared some of the services, the testing services, with the private sector.
With the private sector.
And that seems to have worked quite well. Is this going to continue? Even though you have now cleared that backlog, would this continue?
Well, in my opinion, there's always a place for that public-private partnership. I mean, we have done it in other things. I mean, where clinical is concerned, we by no means, as the National Laboratory Services, is able to take on the gamut of all of the clinical testing, and that's why there are so many private labs, I mean, in country. And I mean, we saw the need where the private labs were there. They had the capacity, they had the training, they had the human resources to do it, and they have done it. And I think it's something that will and should continue in the future, where the private labs, I mean, once they are meeting the minimum requirement in terms of performing these tests to acceptable standards, they should be allowed to continue.
Okay, before I ask some very specific questions about COVID-19 tests in particular, I'd like to bring in Health Nursing Supervisor. Sister, how is it in your neck of the woods?
We do testing basically at the community level, which we do rapid testing, and the PCRs we would send to the lab. We have flu clinics located throughout all of the health districts in St. Vincent and the Grenadines. And so persons have been coming forward for testing. Those who have signs and symptoms, those who are contacts, they have been coming forward to be tested. So that's why the lab end up having a backlog, because persons have been responding, coming to get tested.
So you would say that at the community level, you are very busy?
I would say that, yes, persons have been coming to get tested, especially at the Kingston Health Center, because we have 2 flu clinics in that area, and persons have been coming to get tested.
So where exactly are these 2 clinics located in Kingston?
Okay, so we have one at the Kingston Health Center and the other at Victoria Park. Initially, Victoria Park was carded for exit screening, but where we had to discontinue the exit screening, we asked persons to go there too who would have had signs and symptoms of COVID.
Okay, so who is coming forward to be tested? What are the
Persons
demographics like?
A wide range of persons, children, middle-aged, adults, wide cadre of persons have been coming forward to get tested.
Okay. When should someone consider getting a test?
Well, based on the recommendations from PAHO WHO, you have three categories, well, two categories basically. You have what is called a suspect case and you have what is called a probable case. So a suspect case is anybody who meets any of the three symptomatic description of what COVID-19 is. You have a fever, you have a sore throat, you have diarrhea, you have headache, you have nausea. If you have any of those three, I mean, there are others, but you have three of the descriptive signs and symptoms, then you should consider yourself for testing for COVID-19. And you should present yourself to a full clinic to have that test done. Obviously, you have to protect yourself from the public as well. So when you're coming, ensure that you're wearing a mask and you have some sort of hand sanitization with you. So wherever you touch, you can sanitize. Persons who have gotten in contact with a confirmed case of COVID-19, you have been listed as a contact of a confirmed case, or you're listed as somebody who may be exposed as a secondary exposure, you should consider getting tested as well. I would want to say at this point that some people tend to want to go immediately if you are expressed as a contact. And you have to think about when did the person test positive and when were you exposed to them and how long has it been since your exposure? Because you really have to allow for that incubation period, especially if you're unvaccinated. You have to allow for that incubation period to run. I've known persons who have gone immediately because, I mean, panic setting, of course, and they have gone immediately and they got a negative test and they got complacent because they were in a state where they had a false sense of security. And 3-4 days in, signs and symptoms develop and retesting and they're positive for COVID-19. So you have to think about the exposure time and really to time yourself. You want to wait at least 3 to 5 days before you go for that test if you are listed as an exposure.
So for instance, someone who tests positive today and they live in a house or in a setting with 3 or so persons, do those 3 or 4 persons need to test immediately? Immediately.
Well, first of all, the person who is positive now, we have to look at what is called the date of onset of symptoms. When did the symptoms begin? Because viral shedding sort of coincides with the date of onset of symptoms. You may have viral shedding before, but that is really the proxy that we use for the shedding of viruses. And then you have to look at when the individual in the house would have had contact with that person. And they can just estimate and sort of measure it for themselves 3 to 5 days in and then go to have that test done.
Okay, when we come back, we'll talk about the types of tests that are available in St. Vincent and the Grenadines. Back in just a moment.
I am Hans John, the 2019 Vincent Ragasokamuna. I took the COVID-19 vaccine and so should you. Let's be an example to others. Get vaccinated today and help control the spread of COVID-19.
Vaccinate if you want to eliminate the spread of the virus in our place and do not procrastinate, but rather let us vaccinate. Get vaccinated today.
This evening on the VC3 News Update, the Gamma variant of COVID-19 is the dominant variant in circulation in St. Vincent and the Grenadines. Seismic activity continues to decrease at the La Soufrière volcano, and a Vincentian-owned cargo ship damaged by fire in Guyana. We'll have these stories and more at 7 p.m. this evening on the VC3 News Update.
Welcome back. Before we took the break, you were talking about viral shedding. Just for the layman, what exactly are you talking about when you say viral shedding?
Well, in the simplest of language, you're just passing the virus on. Because it's not at every stage of the infection that you're going to be passing the virus on.
Okay, great. So tell us, what are the type of tests for COVID-19 that are currently available in St. Vincent and the Grenadines?
Okay, so in terms of rapid diagnostic tests, we have two categories available. We have an antibody test and we have an antigen test. Both of them are basically dependent on the other one. So you have an antigen test where the test is designed to detect a nucleocapsid protein of the virus. And that's a very nice test. It works well in your population when you actually have COVID-19 circulating. So it works best in your symptomatic population. And that is why our protocol now, based on our stage of public health response, based on what we are experiencing, we are deploying a lot of antigen tests. So the antigen tests, I mean, some people think that if I don't have a PCR test, they're not in a comfort zone. But the antigen test is designed to detect the nucleocapsid protein on the virus itself. So we're actually looking for the agent of disease. Okay? For the antibody test, what we are doing is that we are looking for a protein that was formed in response to the presence of the virus. If you notice, we don't use a lot of antibody tests now at this point of the pandemic. And that is because two things. The antibody test actually relies on that immune response. So you have to be infected and you have to give your immune system time to produce those antibodies. Now, two things is that the vaccinated persons, they're going to be having antibodies that were produced as a result of vaccination. Because what we do is that we mimic a COVID-19 infection where we give you the spike protein, or actually we give you the genetic codes to make the spike protein inside of your body, and your body recognizes that as foreign and the body triggers an immune response. So it's going to be difficult to use an antibody test to say that you are having a COVID-19 infection and you may well just have been vaccinated. For the persons who are unvaccinated, because it takes such a long time for their immune response to cut in, we don't see antibodies in their system till about 7 to 9 days, in some instances longer. So an antibody test is really not a good test to use at this point of the infection. When COVID-19 may have long gone, and we want to look back retrospectively to assess the impact it has had on St. Vincent, we may well roll out a study where we are going and testing people who have not been vaccinated to see what their antibody levels are like, if they have antibodies to COVID-19, etc. Just to have an epidemiological profile of how bad the disease was. But it's not a test that we can use now to determine if somebody have COVID-19. So apart from your antigen and antibody test, the gold standard for detection of COVID-19 is our PCR test. For that, again, we have two different platforms. So we have a rapid PCR, which is really a system that is designed that encapsulates all of the activities that we talk about in terms of PCR and having that sterile room to prepare your probes and your primers, and these are technical things, and to do your extraction from your sample and to do your amplification. That is condensed into a nice little cassette, and all we do is add the patient sample to that, stick it into a machine, and the machine does everything, and in an hour, we get a result. Those machines are a miniaturized system, and the drawback to them is that the throughput, the amount of samples they can do in a period of time is not a lot. So you have most machines here can do probably about 4 samples in an hour. And when you're looking at 700 samples a day, if you have a machine that's doing 4 samples an hour, then you're in serious problem. So in addition to those rapid PCR, our molecular laboratory is really designed to conduct the traditional PCR, where we have an elaborate layout. We have a specific room that is just designed for reagent preparation. We have another room that is designed for sample extraction, because we have to go into the sample, break it open, and to remove the RNA. And that is added to a set of reagent probes and master mixes and taken to another machine, which is our thermal cycler, to be amplified. Now, PCR is one of the things that people tend to, especially the persons who are against vaccination, tend to harp on. And they will say things like Dr. Kerry Mullis didn't design the PCR to be a diagnostic test. And I mean, I can't sit here and say that Dr. Kremelis did design or didn't design, but we have repurposed it, and it's fit for purpose, because if you don't have the nucleic acid for COVID-19 present, you can't amplify it. So the PCR test is just there to amplify whatever DNA is there that matches the sequence. So we send in specific probes and primers into that sample that are looking for a specific target sequence for COVID-19. If it finds it, it amplifies it. If it doesn't find it, then it doesn't amplify. I was talking to a group yesterday because I did some training in Palm Island, and we were looking at cities. This whole idea of cities really is about there's an inverse relationship between your viral load, the amount of virus you have in your system, and what your city value is. So when you send your probes and primers in, if you have a lot of virus in your system, it doesn't take long, it doesn't take a lot of cycles for the amplification exponential numbers to rise. So you tend to have a low city. So for persons who have done a test and you have a city of 12, it means that you have a high viral load to begin with. And if you do a test and you have a city of 35, 34, it means that you didn't start with a lot of virus in your system, and the system has to actually run a lot of cycles before the signal was at a point where you can detect it. Clinically, that information is important to us when we're looking at what stage in the infection an individual might be. Because that test don't have a definite cutoff. We have to determine at what point we're going to cut it off. I mean, for us here in the region, and I think a lot of the international consensus is that a city around 40. Anything that is above 40 is negative. So if we do a PCR test and we get in cyclical threshold values above 40, then that is a negative test for us. So there's really a lot that goes into testing and stuff like that.
So just to recap, there are 3 types of tests being offered in St. Vincent.
Right. So we have the antibodies, we have the antigen, and we have PCRs. And even with the PCRs, we have the rapid PCRs, and we have the full-length PCRs that takes about 6 hours to complete.
6 hours?
6 hours. That process runs just about 6 hours.
Walk us through the process.
What?
Walk us through the process.
So when we get the samples in, we have to go through what is called an accessioning section of it. So we have to look at the requisition form, because every sample has to be accompanied by a requisition form. So we have to go and look at the information that is written on the form and match that information against what is written on the sample. That's really quality, right? It doesn't sound like a lot, but when you have 600 samples to go through, it takes a lot of time. So we have a team of youngsters. Most of them are set persons that we have taken on from the community college who would sit and do that sort of accessioning process for us. Once the samples are accessioned, then the samples are taken to extraction. Now, extraction is laborious because you have to take a representative portion of your sample and you add that to an extraction buffer. And the extraction buffer is going to break that sample open, and it's going to allow for the release of the RNA material. Now, that extraction process takes about 2.5 hours manually, and probably a little less than 2 hours if we're doing it on the automated system. We have an automated system and we have the manual process, and we run both of them together, especially when we have a lot of samples in lab to do. Now, while the extraction process is being done, we have another person who is working on preparing the reagents. So you have your enzymes, because the PCR reaction, you have to add enzymes, probes, primers. This whole thing is called a master mix. So somebody has to sit and prepare that master mix, and it has to be done in a timely manner, because if the master mix is prepared too soon, then you can lose the viability of your enzymes. So it's really a timed process, and because you're working with such small volumes, the precision and the prudence is really important. So somebody's preparing the master mixes, a team is doing the extraction. Once the two process is finished, then we have a third team that comes in and bring your sample and the master mixes together in the wells, in the reaction wells. We have 2 different types of plates that we use. We have a plate that can hold 96 samples, and we have a plate that can hold 384 samples. So it depends on the workload. It will determine which plate we are going to load. We're actually loading manually now, but we have procured an automatic liquid dispensing instrument that will be able to do that loading for us in the future to speed the process up. because it's laborious to sit and try to pipette samples into 384 wells without making a mistake. You have to have a template in front of you. Very often we do it using 2 persons because somebody have to guide you, just in case you might look up and look away and you're going to put something back in a well that you've already charged before. So we have 2 persons who sit and do that. Once we have the plate loaded, we have to take it to that thermal cycler. And the thermal cycler is the machine that actually does the PCR reaction. So in order to multiply the DNA, we apply excessive heat that breaks the DNA strand apart, and then it goes through what is called an annealing process, then extension, and then it breaks it open again, annealing, extension, and that repeats itself. And for several cycles, if the target sequence for the COVID-19 virus is there, then the probes and the primers are going to bind, and it's going to be multiplying every cycle. So you start with 2 and it's going to multiply exponentially. At the end of 30 cycles, you have millions. And that is what we use to determine whether or not an individual have COVID-19 or they do not have COVID-19. Attached to the end of that target sequence is a fluorescent dye. And what stands next to the dye is a molecule that we call a quencher. And the quencher prevents the dye from fluorescing. But once extension occurs, the dye is cleaved from the molecule, so the dye is in free solution. And when it's by itself, it can fluoresce. The machine is designed to detect that fluorescent level when it reaches a certain threshold, and we can determine whether or not the sample is positive or negative based on the amount of free circulating dyes in the mixture after a certain amount of cycles.
Interesting stuff. We'll be back after this break.
This evening on the VC3 News Update, the Gamma variant of COVID-19 is the dominant variant in circulation in St. Vincent and the Grenadines. Seismic activity continues to decrease at the La Soufrière volcano, and a Vincentian-owned cargo ship damaged by fire in Guyana. We'll have these stories and more at 7 p.m. this evening on the VC3 News Update.
I'm Pete, band leader of Lynx Mass Band. Band of the Year winner 2019. I'm urging you to practice proper hand washing to curb the spread of COVID-19. When you're able to wash your hands, use soap and water to clean your hands thoroughly. Get vaccinated today. Protect yourself and be responsible.
And I urge you, get vaccinated. It is safe and it is effective. Stop the spread, help the fight, and make the choice that is right. And let us unite and do the thing right. Man and woman, let us join in the fight.
I think Dr. Kiza Beach can answer this. Someone is asking, COVID-19 home testing kit is widely used in the diaspora. Does the Ministry of Health, Wellness and the Environment have any scope of getting these kits available in St. Vincent? Surely this can reduce the workload on health workers.
Okay, so I know the kits are available. I know the UK government has been mailing these kits to homes so that persons can use them before they go out to work or before the children go out to school. However, that requires a level of reporting, a level of disease control, a level of vaccination that I don't think we have at this point. Our testing is mainly to identify cases to allow for rapid isolation and quarantine. The use of the home testing, which they have been found to be quite reasonable in terms of sensitivity and specificity. It's not where we are at this point. Because really what's happening is that you're going to do a test, and if you find out, a home test, you find out that you are positive according to the test. It's my understanding that you have to report that, and that there may be some follow-up, or is it that you're going to stay home and monitor yourself and then come back out at the end of 14 days? So all of these are systems that have to be put in place to allow for something like that to function. So is it that we move towards self-testing at home and then you have a mechanism of reporting? So that is something we can think about even as we try to get our children back into school. Once we get a much better handle in terms of persons being confident enough to do the testing, being confident enough to report accurately to our healthcare providers. And there will still need to be that kind of follow-up. It could reduce the strain, but we also have to be very careful about the quality of testing and reporting and the capacity to even follow up on those test results.
Okay, would cost be a factor in determining whether or not we can afford such a venture?
Definitely, that would be significant. As Elliot would tell you, just the antigen testing is an extremely expensive. The kits are extremely expensive. Everything about COVID is extremely expensive. So that would also be, and I know from the knowledge I have of that system, that's part of the National Health Service in England, and that is a service, as far as I know, that is funded through taxation and the sort of the health insurance systems that exist in the UK. We do not have a national health insurance system, which allows for the contributions to be made into the system and then for that to then fund the provision of care. So yes, cost would be a component, something we would have to look at. And with everything, just as we are looking at the cost of the cost in terms of resources, in terms of the exit screening, we're looking at how we manage generally to provide the proper service at as reasonable a cost as possible without having to transfer that too much to the public.
Okay, I was reading something that says that lateral flow tests are more accurate than previously reported, and what I would like to know, what exactly is a lateral flow test?
Okay, that's an interesting statement, because your antibody tests as well as your antigen tests are both lateral flow. Lateral flow just speaks to the design. Okay, so let me explain it to you. This is your test device, right? Think about the pregnancy test that we see in the pharmacy and you can pick up in your department store, right? You have a little well here that says S, and that's your sample well. And there's a little window on top here that has a C and it has a T. So C is where you have your control. And whenever we're doing any experiment, we must have controls. Controls tend to validate that results that you're getting in the end, because as laboratorians, we know if you put water onto a machine, you're going to get a result. So how do you know that the test result that you're getting is actually reliable and accurate? So controls are there, and controls are known representation of your analyte. So if we're testing for COVID-19, we have a control band that is designed to give us a positive, regardless of if COVID-19 is on the patient sample. So we know that the test device is working. The T line is where you have your test. So you add your sample, and the sample flows across a membrane. It's a cellulose acetate membrane. It's just a big word to say that it's a special kind of paper that allows the sample to flow across chromatographic movement across that paper in a lateral movement. And as it flows, it is designed to move across these capture zones. So in the first capture zone, you have immobilized. If it's an antigen test, you have immobilized antibodies there in that capture zone. And as your sample flow across, the antibodies are going to bind to the antigen because it's a specific reaction. When I talk to people about vaccination, and I talk about the purpose of vaccination, I tend to tell them that what you are doing is that you're putting specific policemen at work. So we are giving you a molecule that is going to mimic the virus. And it is going to bring about a response that creates antibodies that are specific to the virus. And these antibodies are what is actually on this capture zone. So as the antigen comes across, it's going to say, hey, I know you, and they're going to bond. And that is really how the lateral flow system is designed. But a lateral flow system can be an antibody test, and a lateral flow system can be an antigen test. So it's really, they're speaking about the design. And yes, the design has gotten better over the years, and that is where we have so much confidence in our antigen tests. We understand why we can't use an antibody test at this point in the pandemic, but we have a lot of confidence. When we look at Dr. Keyser spoke about specificity and sensitivity. The sensitivity of a test is really the ability of a test to detect very small traces of whatever you're looking for. So if you have a new infection for COVID-19 and your test sensitivity is at 95%, you have a 95% chance that your test system is going to be positive if you have that disease, regardless of how small your viral load is. The specificity of the test speaks about the ability of a test to give you negative in the absence of a disease. So you want to rule out all the false positives. And then you have things like your positive predictive value. So yes, lateral flow, we have improved on the technology over the years, but it doesn't speak to any particular test. It doesn't speak to an antibody test. It doesn't speak to an antigen test. The lateral flow is just primarily a design.
Okay, great. Thanks for that. Okay, so Dr. Keyser Beat, someone is asking, will the ministry accept donations of these kits?
Yes, we would, but again, as I said, we have to have a system put in place. We'd also have to do significant education in terms of how we would use that, okay? So, and also in terms of the reporting, because once you get a positive, it will then be that we have to ensure that persons are willing to provide that information, because already we have instances where persons are told that they're positive, they are advised and they're given their orders to stay at home and to isolate, and they don't, they don't inform their employer, they don't inform their co-workers, and they turn up to work, or they go out because they need to get something to eat. I understand that, but you don't expose other persons. So we have to be at a stage where persons can be relied on. And I mean, let's be real, okay? Let's be real. We have to be at a stage where persons can be relied on to, one, do the test properly, and two, to accurately report and be responsible enough to stay at home, report, inform about their positive test. So there's something we can look at. I know some of these tests are already being used. I know some sporting organizations, they're using those tests before the sporting activity. So we can determine how we can use it, and in what situations. Maybe it's something we would want to use with the teachers who would have a level of the reliability, so that they can say, okay, before I go off to school today, am I going to be doing a test? So it is something we would have to look closely and be very careful in terms of how we utilize it. I'll say that much.
Okay, and someone is asking another question of you. It is evident that rougher seas are ahead as per COVID-19. If SVG is to flatten the curve, knowing that the Christmas season is around the corner, what measures do you think the authorities should take to minimize any possible increase of infections? And can action be taken against bus operators who continue to disregard the protocols?
So I would say, okay, we have a lot of protocols, a lot of regulations in place. We need enforcement, and we need compliance. And we need not to be persons who need to have somebody with a stick behind you to make sure you do this. We are all being affected by this. Our children have not been in face-to-face learning for so long. We have children who are going into primary school for the first time. We have children who are in grade 5 and grade 6. We have children going to Form 1 for the first time. Children who should be in 5th form getting ready for their CXC. Children who should be in community college. And the only way we are going to get there is if we increase our vaccination, if we comply with, if we use our mask in a van. If a van pulls up next to you and they're full and they're not complying, you should be responsible for yourself. You should try to not take that van and take another. I know it might be difficult, but if we're all doing that, if everybody does that, it'll be much better. In terms of Christmas is coming up, we don't even have to go that far. We're not even going to have independence celebrations. You know, we're not going to have independence parade. Why is that so? Because that's a mass gathering. So until we understand that every individual in St. Vincent has a responsibility to comply with the regulations, with the recommendations, they're very simple. Wear your mask, sanitize, distance, and get your vaccine. You know, I don't know why it is that we feel that, okay, so Christmas is coming, so we're going to put in place even more restrictions. We're not even complying with the restrictions we have now.
Okay, thank you. And before we go, someone is saying, so much knowledge. I live in the US and never heard such knowledgeable explanation on any forum. Glad I tuned in. Mr. Labtech, you are great. We'll be back in just a moment.
Everyone, I am Shakel Bob. I am a former Miss Pitani, a former Miss Rural SCG and Miss LCG contestant and runner-up. I'm a lawyer by profession, but a pageant lover at heart. Do not let the negatives prey on your mind, because a stitch in time saves 9. So, it's COVID vaccination time. Get vaccinated today to reduce the impact of COVID-19 in St. Vincent and the Grenadines.
And I urge you, get vaccinated. It is safe and it is effective. Stop the spread, help the fight, and make the choice that is right. And let us unite and do the thing right.
This evening on the VC3 News Update, the Gamma variant of COVID-19 is the dominant variant in circulation in St. Vincent and the Grenadines. Seismic activity continues to decrease at the La Soufrière volcano, and a Vincentian-owned cargo ship damaged by fire in Guyana. We'll have these stories and more at 7 p.m. this evening on the VC3 News Update.
Welcome back. My apologies. Apparently our mics were opened during the last 3 breaks. I don't know what is happening, but do accept our apologies for that. That's certainly beyond our control. There's a news that one of our resorts in the Grenadines has actually purchased their own PCR machine. What is the link with that particular institution and your lab?
Well, as I've mentioned before, that public-private partnership is extremely important, and it's something that we foster. We actually have 2 resorts to date who have procured their own point-of-care PCR testing device. It's actually called a Gene Expert machine built by a company called Cepheid. Now, this wasn't done in isolation. Talks were had with the Ministry of Health. I mean, dialogue was always fostered. We actually guide them in the right direction as to what instrument to buy and ensure that they were doing the right thing along the entire step of the way. One of the things that the Ministry of Health will do, and which is really entrusted with the Laboratory Services Program, is to ensure that the resort have persons who are trained to operate the machines and persons with the right competencies, because I don't want the public to walk away with the impression that we have hoteliers operating the machines. I know Mandarin Oriental, a doctor is there, and a doctor was trained by the firm that they bought the machine from. It was part of the purchase agreement.
Okay, so this is another resort in the Grenadines.
Yes, Mandarin Oriental in Cameroon was the first to actually procure a gene expert. And now we have Palm Resort, who is on board now. I actually just came from Palm yesterday. I was in Palm to do some quality inspection and training with the team in Palm Island, and it was really a good venture, you know. So it is not done in isolation. A lot of people think that these things operate in a mystical paradigm, and they don't. The Ministry of Health is very involved in it. So the procurement arrangement will actually see the manufacturers coming to St. Vincent, setting up the instrument, verifying that the instrument actually works, and to train the health service provider, nurses and doctors who operate these machines at the resorts, and not the hoteliers themselves. We have to ensure that there's a space that the hotel can provide where the testing can be done. That is an off-limit space, and both resorts have actually done this. What we do is that we go in after the fact to ensure that the space is adequate. There's no breaches to things like waste management. There's no breaches to things like safety. There's no breaches to things like human resource in terms of competency, the persons who are doing it. While these are point-of-care devices and they can be operated by a healthcare professional, we do have to ensure that the persons who are working with these machines are persons who have the right competencies, and they exist in both locations. The laboratory will go through what is called a validation procedure with the hotel, where we would have them do a blind panel. So we send them a blind panel first with about 10, 20 samples, positives and negatives, and we allow them to run those samples. We look at the results, and we determine whether the competency level is to our satisfaction or not. Having done that, we still require them for the continuation of the operation to submit all of the positive samples and 10% of the negative samples, so we can continue this quality check. Dr. Keys also mentioned about the reporting component of it, and that is very, very, very important, where they have agreed and they are required to, by the laws of St. Vincent and the Grenadines, to submit the information to the Ministry of Health. So it's a partnership that can work. I've seen an article about the hotel. They're doing it because they don't want to conform to the quarantine stipulations of the Ministry of Health, but that is so far from the truth, because they still have to conform. It just means that they have the capacity to do the test with them, and their guests can have a quicker turnaround time to results, and they can now be released from quarantine without having any adverse delay because the lab is backed up with samples and stuff like that. So that was just the whole intention, where these resorts have decided to, because they are expecting influx of guests for the season, and they don't want to have guests who samples is sitting at the lab 3 days can't get a result because the lab is backed up again.
And it also eases the pressure.
It eases the pressure on us, because we have people with the instrumentation and the competencies who are taking some of the workload from us and also from some of the private labs.
Okay. Question for the CMO: what additional protocols will be put in place to avoid a repeat in the spike of cases that occurred over the last Christmas period?
So I think that's a variation of the same question. What happened last year is that we think that we had protocols in place where persons left isolation, left quarantine on arrival after 5 days, I think it was. And what we realized later was that persons were testing negative on the 5-day test and turning up positive later on, because we actually had about 4 or 5 cases, from what I remember, where that was the case. And also we know what happened where persons actually, instead of going home to continue the quarantine, which was required in some cases, they did not do that. They were not compliant. So what protocols do we have to put in place now? At this time, we have protocols where vaccinated persons spend 48 hours in a hotel. They arrive with a negative test, and we do testing for some of them, depending on their peculiar whether it's a family of 5, we might do testing of 2, or we might test everybody if you're coming from a particularly high-risk country or a particularly high-risk occupation, or your PCR test or your vaccination card. We are a little concerned about it. The unvaccinated persons are either quarantining for 7 days, 14 days, 5 days. So depending on the level of activity in the country they're coming from. And those are the ones we are most concerned with. Remember last year we were dealing with unvaccinated people. The majority of persons coming in, they were unvaccinated. Now, the majority of people coming in are actually vaccinated. The unvaccinated ones will continue to be quarantined and tested either, as I said, 7 or 14 days or 5 days, depending on what the protocol is for those persons. Any additional protocols would probably be in terms of where persons can go to and in terms of safe zones, so that you're saying that only vaccinated parties, if we start that back, vaccinated gatherings, and those persons who are not vaccinated, we do not facilitate the gatherings as much as possible of those persons. So it will be basically around that way, where we understand that yes, vaccinated people can still get infected and can still transmit, but the risk is much less. And so therefore, the emphasis would be on allowing, if any activities are allowed, it will be more to be towards the vaccinated groups. And it is our great desire that by December, we would be much better in terms of the level of vaccination we have. We have persons like Sister out there working long hours trying to get that happening. And so we, that's our hope for Christmas time, to avoid another spike. But I mean, we're in the middle of a spike now. So our hope for Christmas is that we'll be out of this spike, so that we can at least have some sort of Merry Christmas in St. Vincent.
Before you go, of course, the U.S. recently elevated us to level 4. What are the implications for us?
We joined the group of other Eastern Caribbean and most of the other CARICOM countries had gone up to level 4 long before us. So, and because, as you know, our spike happened later than theirs. So, implications are, the advice is that only if you're fully vaccinated, you should come to St. Vincent. But this is just advice. So the traveler still has the option of coming to St. Vincent if they so desire. But also remember, come November the 1st, anybody going to the US must be fully vaccinated. So that is going to cut down a lot in terms of the traffic, I think, in terms of persons going up and coming out of the US. This is something we have to think about, because they're saying persons coming in must be fully vaccinated. I guess those are immigrants or non-residents, non-nationals. But the warning, the advisory that was put out in terms of putting us at level 4, just ask the persons coming to be more cautious. And already we have seen, even before this, the majority of persons coming to St. Vincent from these countries are already vaccinated. The vaccinated travelers, that's the majority of our travelers right now.
Okay, you have the last word. You and Sister Brown would have the last word.
Well, I just want to wrap up by saying that, I just want to do a little bit of public service announcement. For persons who are traveling to the US, you can do an antigen test, but you need to take into consideration what your route entails. So if you're on a direct flight to the US, you can do an antigen test. It's much more affordable, because I know one of the things that persons tend to meet and complain about is the cost of doing a PCR test in the private sector. And I must say that a PCR test is a very expensive test. Teresa, within the last 2 months, the Ministry of Health has expended over $1.3 million US dollars in terms of buying resources to equip the lab to keep up with the surge that we're seeing here. It's not cheap to do a PCR test. The government have been highly subsidizing it. So the traveling public, if you can get a less costly test, you should do it. A lot of people just figure that I have to get a PCR test. But there are a lot of destinations, especially if you're traveling to the US. A lot of our travelers go to the US. You can do an antigen test. And if you're not going through Barbados, you're not going through any other destination that is going to require you to have a PCR test, and we do have direct flights from St. Vincent, then you can do an antigen test. The antigen test can be done in the community as well. You can go to the community points and get your antigen test. You get your card issued there, and you're on your way, right? So that's just my last bit of information for them, that when you're traveling as a traveling public, I know a lot of persons are concerned about how they're going to be affording it. The private sector can't afford that subsidization that the government do. I mean, for us, it's a merit good. Health is a merit good. I'm not even sure the government will be able to keep that cost at bay for much longer without having to do some adjustment to it. But, I mean, just as advice to them, you don't have to have a PCR every time you're traveling. Just try to determine where you're going and get the information from your destination country if they will accept an antigen test, and you can do an antigen test to be on your way.
Oh, great information you can use. Sister Brown?
Okay, so in wrapping up, I would like to look at home treatment for persons with COVID-19. And one, we advise that you stay hydrated, so you have lots of fluids. We have an abundance of coconut water here, your water and fruit juices. Also, you get adequate rest. You eat a healthy diet from all food groups, but focus on vitamin C, zinc, vitamin D foods, and of course, sunlight. Also, that you exercise. I know it's difficult to go out, but you could walk around the home, do your exercise. You could also do steam inhalation to help with mucus. If you have a cough, you could also use honey, put some lime or own home remedy, some lime in it and drink it. That would also work. Also to use deep breathing exercises. This too would also help to get rid of mucus, and ensure that you have adequate ventilation inside the room, right? So open the windows to ensure that you have ventilation. Also, if you have fever or you have pain, you can use paracetamol or Panadol. Most importantly, we ask that if you think that you are getting more sicker, that you don't stay home, but that you seek medical care. So if you're having chest pain or you're having shortness of breath, we advise that you seek to get care. Also, look out for our vaccination caravans throughout the different communities, where we'll be doing vaccine, we'll be administering vaccine, and also administering COVID rapid test as well. The vaccines are safe. I know that they're fairly new and persons have their resistance, but there's light at the end of the tunnel. And slowly, I believe, we would get to our 70% population being vaccinated. Most of all, it was nice being on this program to share information, and hope to come back someday. Thank you.
Thank you. Information that you can use there again. Well, thank you to our panelists, Dr. Kiza Beach, our CMO, of course, Mr. Elliot Samuel, Chief Laboratory Technologist, and Health Nursing Supervisor, Ms. Glendorine Brown. That's our program for today. So glad you could join us. See you again next week, same time, same place. Good evening.